Hi, everyone. Welcome back to Urgent Care Unscripted. My name is Barbara Ronalter. I am the Director of Operations and Business Development for AFC Urgent Care in West Haven.
And this is Mohammed Zaman. I'm the franchisee and owner of the AFC Urgent Care in West Haven. Today we are here to discuss workplace safety and occupational health services, something that impacts every workplace, no matter the size of industry or where you work, you are in it, and we are going to talk a little more detail about it.
Yeah, this is definitely a topic that I think goes under the radar for most people, and they don't think about occupational health when it comes to an urgent care, but it's very important, and it can definitely make a difference for your business and for yourself as an employee as well.
And I'm Felix Pacheco. Happy to be here. I'm Medical Director for the AFC West Haven Urgent Care.
And we are very happy to have Felix here. He's our veteran ER physician at the clinic, and he's the leader of our clinical team at West Haven. So now we go.
Yeah, let's start with the topic. What is it that we can actually do for employers at an urgent care?
Every employer wants to ensure the health and safety of their employees. So if there, injuries happen at work, occasional slip and falls, people work with machinery, and when these accidents happen, they need usually a medical evaluation. Is it safe for them to return to work? Is there any significant injury to the individual? So in those cases, you need an evaluation, and we can provide that sort of medical evaluation.
Yeah, and in what Dr. Pacheco just said, if one of the keyword in there is accident, that can happen anytime. And responding to that keyword, AFC Urgent Care West Haven is open 7 days a week. You can walk in anytime. You can even consider or consult with us before you have to go to an emergency room, and we can advise what the next step could be at the urgent care.
Yeah, absolutely. One other things that we also do at the urgent care for a lot of the employers is a DOT physical. So that's a big one. And we can also do employment physicals, drug screenings. So those are all boxes that we can check as your partner in this, employer world. There's also a key level of access when you have an urgent care that you're working with directly, because you're going to get your results on time. You know that you can get your patients in and out as quickly as possible, since you're paying for that employer's time. So if you have a relationship with your local urgent care, I think it's a big help and a big difference for your business for sure.
And again, to that keyword of when the accident happens, you want to be prepared for that. And as long as you have that relationship with the urgent care or the local clinic, what comes with that relationship? If we can get some more information about the profile of your industry or the profile of your workforce or the job descriptions of your staff, then we can be better prepared to serve your needs when that accident happens and know about what kind of injury and help you in a more educated manner.
Yeah, my initial response, I was focusing on the current employee, but Barbara actually mentioned a good point in terms of like the pre-employment process and how screenings are typically involved there. But then there's also continuous screenings for certain positions like, DOT physicals and, truck drivers and such. So we do all that. If you think about the things that are required for a medical exam in general, a pre-employment physical and minor injuries, pretty much include that as well.
Yeah, Felix, can you touch base on a little bit from a provider's perspective, what that importance is in your eyes to have a relationship with an urgent care when it comes to getting your employment, even getting back to work, like as far as restrictions? I know that sometimes that's tough for you guys as providers to determine whether or not you're going to send that patient back to work. But can you tell us the difference between knowing the job descriptions and knowing what they can and cannot do versus you just being blindly told this patient can't go back to work?
Yeah, like with any functional assessment, trying to get an idea as to what they do as a baseline helps determine whether or not they could return to that. A good example would be someone that's like lifting heavy objects all day. If they have a back injury and they can't bend over, then obviously it's a to that. However, if they have like a cut, a minor cut, that wouldn't necessarily prevent them from doing the heavy lifting. So, that said, a functional assessment, the location of the clinic, especially in relation to the facility and the employees' homes, make it easy to get rechecked, because oftentimes you make an assessment and the injury is such at time 0, but in 3 days we expect it to be better, but I mean, will it or will it not be? It's unclear, and they sometimes need reevaluation, and the convenience of location makes that more feasible.
So I think what we are trying to say here is that there is a smarter and more collaborative way of handling this kind of situation. You would want to think about it in like an end-to-end solution. When you have that relationship in advance, when we have the profile of your workforce, when we know what kind of injury they might come in with, and we know that you want that staff to be back at work as soon as possible for the staff's benefit, your benefit, and we want to work with you to provide that solution in as perfect manner as possible. And that all requires that pre-work of establishing the relationship, sharing this information in advance, and not wait for the accident to occur, with a clinic that's also geographically, to Felix's point, is close to you, so that it's the most efficient and time-saving for everyone. Right, and that's where AFC Urgent Care West Haven comes with that proper planning and advanced notification and so forth.
Yeah, I think one thing that employers a lot of times don't think about is that pre-employment physical. I think it's a great way to have a baseline of where you're starting with that employee, because like we've mentioned here, accidents happen, right? But if you know that that employee had previously a back injury, you might know at that point, okay, well, if this employee has a back injury, then I know that I can't put him in a position where he's going to be lifting heavy boxes. So we'll be able to kind of assess that for you and fit the right role for that person too. So it's a great way. And I think it keeps your employees happy. If you're doing that yearly physical, you're less likely to have somebody getting sick all the time because you're trying to catch these things ahead of time. Right, Felix? Wouldn't you agree with that?
Yeah, the preventive aspect could play a small portion of it, but it could hopefully identify things earlier on and ideally prevent the kind of injuries that could occur at the workplace.
Yeah.
Yeah, and I think it also goes like the different kinds of injury. Plus, there is a physical aspect of being injured, and then there is a psychological or mental aspect of, some suffering also that will have to be addressed and properly solved for. I mean, mentally, a person once affected physically, that mental effect can carry on for days and weeks and months, and that can affect the work also. So how do we handle all of that? We work with you to put together proper solutions.
Yeah.
I'm also a board certified psychiatrist, so that we can. I'm joking.
He is joking. So when employers make, I think, health just part of their workforce in general, it definitely improves their workforce. It improves their employees' health, makes them happier. We have a business that we run between the three of us. We have obviously tons of staff that we work with, and I think one of the big things that we do for our staff is keeping them happy mentally. And sometimes that includes making sure that they're being properly treated, but it also ensures that they're getting their health checks within the time frame that is needed. So thankfully we are in urgent care, so they can come to us anytime, but it's good to have that relationship as an employer.
Yeah, I think it's one less worry. One less worry. That's it.
Yeah. And if you are a business owner or a manager listening to the podcast right now, so again, to build that relationship, now is the best time versus waiting for the next accident to happen and impact your business. So you would want to be proactive about it and reach out and start working towards, proactive solutions.
Yeah. Oh, one thing I didn't mention that I wanted to touch base on is when you have a relationship with your urgent care, typically you can get lower pricing on all the work that or all the physicals and checkups that you are, or even a sick visit. If you don't want to go through your workman's comp, you can do a direct pricing with that location, and that way it doesn't affect your workman's comp. So those are also things to think about as a business owner, building that relationship with your local urgent care for sure.
Definitely.
I think we covered a lot about the workman's comp and occupational health topic, and how to handle this in a planned manner. What are the benefits of staying in touch? What are the benefits of sharing information with your closest and best urgent care clinics for the benefit of you and your staff? I appreciate listening to the podcast, and thanks Felix, and thanks Barbara for joining.
Thank you. We're located at 354 Sawmill Road in West Haven.
AOC, the right care right now.